We are going to look at the pre-operative care. Okay, so we have done a lesson using a lecture with the method, and now we want to look at another lesson where we look at different points from that lesson that we had already done. I will encourage you to look out for that lesson and also see what we discussed there. Okay, so here we are just trying to amplify on a lot of points that you need to take into consideration when you are doing a pre-operative care. So in pre-operative care, that is for emergency, we are saying we have to write about the resuscitation of the patient. So what should constitute a resuscitation? So you cannulate the patient in order to administer drugs and fluids for resuscitation. You commence intravenous fluid such as normal saline to prevent hypovolemic shock. Okay, so then other things is that you collect the blood for urgent hemoglobin to establish the extent of blood loss, grouping and cross-match in case of need for blood transfusion. Then you also have to keep the patient warm to prevent hypothermia that may be due to loss of fluids. Okay, so the other intervention is to commence patient on oxygen if prescribed or there is need. So by the doctor, there's the one that can prescribe that the oxygen is needed, or if you assess that there is need, then you can characterize the patient to monitor urinary output. Psychological care. You can quickly introduce yourself to the patient and relatives to gain cooperation and create a rapport. You can explain the condition to the patient and relatives to increase the patient's knowledge in order to enhance cooperation. You can explain the necessity of immediate surgery as it is necessary to save his life. So this will promote cooperation in the patient. Then quickly you can allow the patient to ask questions and answer them accordingly to promote understanding and cooperation. And also it helps to allay anxiety. Explain to the patient that the operation will be done under anesthesia, okay, so that the patient is not worried about the pain of cutting that is involved in surgery. Okay, so you can tell the patient to be that in case of pain after the procedure, an analgesia will be given that will relieve pain after surgery. This will also reduce the pain that is related to the wound that is created after surgery. You can explain every procedure done on the patient that will promote participation in his own care, and you can work calmly to avoid alarming the patient and increasing anxiety like blood pressure, which may affect the operation. So you can work calmly, do procedures in packs so that you do not disturb the patient. You can explain to him that he may come back with drains from theater or tubings from theater, depending on the type of surgery that will be done. This is to promote patient's cooperation postoperatively, and you can involve the family members in the care of the patient as they can also help in offering emotional support. You can explain about the strange dressing that the patient is given. Okay, this will also promote cooperation and allay anxiety as the patient is given a gown to promote sterility. So it is not to harm the patient, but it's for the good of the patient. Yeah, you can also explain the machinery and the strange environment in the operating theater. This will also help to allay anxiety in the patient. Okay, so now we talk about consent. After the patient has agreed to undergo the operation, you can ask him or her to sign the consent form to act as a proof that the patient has allowed the surgeon to carry out the procedure. If the patient is not able to sign, the next of kin or the head of the institution can sign to avoid claims of illegal surgery. Investigations, you can quickly collect the blood for grouping and cross-matching in case of blood transfusion. that is, which can happen intra or post-operatively. So the same blood collected that will be used to estimate hemoglobin levels in order to establish whether the patient needs a blood transfusion. Other investigation is ultrasound that can be done for confirmation of the diagnosis. Blood studies can quickly be done to include clotting to rule out a prolonged bleeding disorder. Okay, so you can also do a random blood sugar to rule out hypoglycemia. Physical preparation. Physical preparation includes bowel or bladder preparation. Under this, you administer an enema if you assess that there is need or if it is ordered. This is to evacuate the bowel in order to prevent the fecal incontinence. You can catheterize the patient to avoid injury to the urinary bladder during operation, and catheterize to avoid the urinary incontinence that is intraoperatively. You can also insert the nasogastric tube to aspirate the gastric contents. You can also, according to surgeon preference, shave or trim the part that will be operated on. This is to avoid the close infection or infection. You can quickly wash the site with water and soap or antiseptic to prevent the skin, that is to prevent infection and also infection during operation. Observations. You can do temperature, pulse, respiration, and blood pressure. This is to act as baseline data intra or post-operatively, and you can weigh the patient so that the weight will be used for drug calculation intra and post-operatively. Other observations include palpating the extremity for coordinates to rule out hypovolemic shock, and checking the nail beds and mucous membrane for bluish color to rule out cyanosis. You can also measure oxygen saturation using the pulse oximeter. Okay, you can administer in pre-medication. To do with pre-medication, you can administer the drugs according to the doctor's order. So the common drugs are prescribed are antibiotics. Okay, these antibiotics cover prophylactic. They are given as prophylaxis. Okay, cloxacillin 500 milligrams 3 times a day to combat infection, or any other drug can be given as prophylaxis. Atropine can help in drying up a secretion during surgery. Labeling, putting the patient, putting an identity on the patient. This label has a name, age, and sex, and also the type of procedure to be done. Gowning of the patient. Before the patient goes to theater, the patient should be given clean gown, as this will reduce chances of infection. Removal of cosmetics and prosthesis. This removal of these things is important to, when you remove, let's say, nail polish and the likes for easy observation of cyanosis. Then, if a patient has dentures, to prevent electrocution. Okay, so makeup and nail polish removed, jewelry should be removed for safer keeping. And the patient may wear, removal of cosmetics, the patient may wear a wedding band to surgery, but it must be secured, and they may wear a wedding band, so it must be secured with tape and gauze. Remove prosthesis and assist the patient, or provide privacy so that the patient can remove the prosthesis. Transportation of patient to operating theater. You can transport the patient to operating theater with a qualified nurse on the head side for continuity of observation, and carry all the patient's charts and results for continuity of care. Upon reaching the operating theater, you can hand the patient over to the theater team for continuity of care. Okay, then preparation of post-operative care and beds. You can make a post-operative bed for continuity of care, and then The postoperative bed should be made with clean linen for comfort of the patient. The environment for nursing your patient should be well dusted to prevent bacterial colonization and prevent nosocomial infection. The environment should contain a vital signs tray for observation of the patient within the critical hours after operation. Then you can put an oxygen concentration concentrator near the postoperative bed in case of oxygen demand and administration, and have the suction machine ready in case of suctioning or for secretion. So now, in pre-operative care, okay, so as earlier mentioned within the other lessons where I've talked about pre-operative care in an emergency. So an emergency is anything that may affect airway critically, anything that may affect breathing critically, that is suddenly and or it may affect acutely and critically affect breathing, or it may acutely or suddenly affect circulation. So circulation has to do with the blood circulation or fluids that have been lost. Okay, if someone is having like hemorrhage, has lost a lot of blood, so that would constitute an emergency. So the mnemonic that we use on the pre-op emergency is A, B, C, D, E, F, G, H, I, J, then NPO. So these are just some, okay, not all, but they are just some of things that you may need to do for the patient pre-operatively. So under resuscitation, we are saying you need to look at the airway, you need to look at the breathing, and then you also need to also look at what you can do for the patient in terms of circulation. Now, since this is pre-op emergency, we are saying C for circulation, and C can also be used for consent. Then D is for pre-medication, then E is for environment, okay. F is for opening an IV line or open a vein. So that is F is for fluids. You give fluids, okay. G is for giving a gown, okay. That is a sterile gown, okay. H is for hygiene, promote hygiene, ensuring that the place where a patient will be received is well dusted. The place that will be operated on is also removed, is cleaned also, okay, or you may need to shave. Okay, so that is H for hygiene. I is for investigations that needs to be done. And investigation, we said HP comp lab, that is history, a physical examination, computerized investigation like X-ray, scan. Okay, then laboratory investigation like full blood count, cross match, clotting time, those that can be done. Okay, so then that is I. Then I is also for identity. Patient should have a label, name, sex, age, type of operation. Okay, then this I, J, remove jewelries, prosthesis, and the likes. Then N is for, in an emergency, we are saying put nasogastric tube to avoid patient being constipated, patient vomiting during theater, because anesthetic drugs affect peristalsis. Okay, so then talking of N, looking at all those things, so it's nutrition. Then P, psychological care. Then O is for observation. So that is it. We are looking at the pre-op emergency care and some of the most important elements that we need to highlight when we are looking at a pre-op emergency. Okay, so we have talked about those elements that you need to bring out. Of course, the elements we have talked about are not exhaustive. You can always try to add in more. So this has just been a brief lesson on that. So thank you very much and keep on studying.